does the built environment influence health? Now, that's a fairly broad question, but I think the real question is challenging the influence of the built environment on sedentary living. So how do we challenge what the built environment does to us in the retrospect of our sedentary lifestyle? So before we start, let's just talk about a definition, or at least a working, operational definition of the built environment. Because the built environment might mean something different to all of us. So this is just a typical picture. You can see this is a very, very urban environment. So you can see that there's different types of streets patterns here. There's actually a boulevard down this street. We have mixed density. There's all sorts of environmental influences also on this building, on this built environment. So let's go back to our operational definition of the built environment. So obviously these are human-made surroundings. They provide the setting for activity, and they provide those physical connections for where we work, where we live, and where we play. And the built environment operational definition comes from really an interdisciplinary field. So this isn't a strict definition, it's just an operational definition. But what I'd like to do is give you the one-slide answer at the beginning here so that we can work through this. There is clearly an influential role of the built environment on health, and that can be a positive or a negative. There is a multiplicity of factors that impinge on our health in the built environment. And there's a range and diversity in the literature that points to the complexity of knowledges that need to be integrated into planning. In fact, in the last 5 years, the amount of literature on the built environment has quadrupled in terms of research. So there is a lot of research out there. The difficulty is trying to connect the research so that it all makes sense, because they're from different fields. And then finally, there's a multiplicity of actions that would be required to positively impact public health, from the literature to the evidence to policy to health. And so in actual fact, what I'd like to do is challenge us a bit today to think a little bit differently than we would normally. And I can't take credit for this information. It actually comes out of a report that's written. In fact, there's a lot of very good reports out there. But what I'd like to challenge you is to quote Bev Dempster for a moment here. Now, I'm a person who is in preventative care. That's my primary focus, is prevention. And she challenges us to think outside of that and to think more from the perspective of creative solutions, getting people involved in creative solutions. And we're going to work towards that. So let's rephrase. What is the magnitude of the independent effect of the built environment on physical activity? So can we actually pinpoint the built environment in terms of physical activity? Is there really just the built environment that influences physical activity? And I don't believe the answer to that is yes, right? So we know that we can't answer that question. So how do we measure this if there are many factors and actions that impact physical activity and then health? How do we possibly measure that to see where the influential factors are on the built environment and health? Well, if you're a statistician, this would be a great job for you. And if you get a Canadian Institute of Health Research grant, then you're very fortunate because you can hire a postdoc and he can do this for you. And I've been very fortunate, and I've hired a postdoc. His name is Gavin MacDonald, and he is phenomenal. All right? So let's challenge us. Let's go back to the Greek philosopher Heraclitus and say to ourselves, the challenge is to not only think, but to challenge us the way we think. And what that means then is to join together the seemingly unconnected. So things that are in the literature, we have to bring them together, because a geographer and a physician aren't always on the same plane. And a physical activity expert and an urban planner aren't always on the same plane. So what we have to do is find a way of joining the seemingly unconnected. But I'd like to give you a frame of reference to start off with. And that is, when I was asked to do this talk, and I pulled my information together, I thought and I thought and I thought. And I actually struggled quite a bit putting this together. Because in reality, my background is public health and clinical exercise physiology. And so what I really like to do is take blood and take blood from everybody and anyone who will give it to me. And I like to exercise people, and I like to give them preventative health tips, and I like to look at their nutrition, and I like to find out in the end what their arteries look like. That's a long way from the built environment. However, I do have a background in epidemiology, so I can bridge a bit, and I do know a little bit about the process and the outcome of research. So I felt that was a pretty good grounding point to at least go forward. But as you can well guess, I was still lost. All right? So in the end, I started back and I thought, you know what, I have to give you my perspective. I have to come from the basis of where I think. And I felt that there was a lot of people in this room today that are clearly much smarter than I am, probably even know more about the built environment than I do. But I feel pretty certain that the perspective and the insight I give you today might be slightly different than what you thought. And so that's where I'm coming from, is my perspective. So let's take one step back and 3 steps forwards. And what I'm going to do is I'm going to work through my outline with you. And that is I'm going to start off with the evolution of sedentism or sedentaryism. And then I'm going to go to genetics and the adaptation. Talk about travel behavior, the determinants, the lived experience. Talk about a few studies that I've been involved in with some of my grad students and colleagues. And then we'll go back to the frame of reference, which I'm going to talk about in the next slide. And then we'll talk about the built environment and health, and come to that very, very salient point of created solutions. So since the dawn of mankind, we've been interacting with our natural environment. So what's key to this is that we clearly were born to run. And in fact, if you go back and look at the genetics of what we do really well, we are one of the best runners, if not the best runner, in the animal kingdom. Because we can run marathons, we can sprint, we can do a lot of things. And if we think about the fact that running down prey is a way of life, or was a way of life for us, we have to remember that maybe our survival might depend on that. And many of the cultural anthropologists talk about how, we probably ran 10 kilometers, or at least walked 10 to 20 kilometers a day. And so from that perspective, that's where we've come from. And we have to think about how that will be impacted by our future lives. But what's interesting is to think about this in a construct of a frame of reference. And so the theoretical construct in which research develops to think about problems is what we need to do today. Our basic unit of study is the population. So public health, the population. And we will look at genetics a little bit. We'll look at the environment, i.e. natural and the built environment. We'll look a bit about the socioculture. We'll definitely talk about behavioral components. And these will all contribute to the determinants of how health is influenced in the built environment. So sedentism is not new. In fact, it occurred during the Paleolithic era when tools were developed and we had to become more multitask and use our hands. It became more common with the agricultural development, and then when that revolution came along, we actually got involved in being in a fixed habitat. That fixed habitat might even be called forced sedentism. In other words, we have where a dominant group restricts our movements. And most cultures have actually bought into this sedentary lifestyle, or this version of sedentary civilization. And even the very last group, the nomadic group, is also now in a scenario where they're in a fixed habitat. So we've moved from roving the savanna to being involved in a fixed habitat. A fixed habitat changes a lot of things in our life. In fact, it impacts health excuse me, quite dramatically. So when we think about shifts in disease, major shifts in disease, a lot of those come from when a plague comes about. And that plague then changes the population. And an epidemic shapes basically human history. So if we look at the graph down here, we can see that this isn't a very big peak, but typically we see epidemics with a sharp peak. And what we have is starting off with low disease or low morbidity, and eventually we have high mortality or high death rate. And so when that happens, it changes the history of what's going on. If we move forward and think about these high mortality rates, we realize that social collapse can easily occur from that. And what we see is a couple of determinants come out of that social collapse. One is helplessness, poor medical care, and insufficient nutrition. Now, we actually have some of those factors occurring today, but just in a slightly different environmental context. We actually have overnutrition, or maybe we are just eating too much for our lifestyle. We have a few issues with healthcare, but we don't need to go into those, I don't think. And there are some people that feel that there is a bit of helplessness in our society. If we go forward and we talk about the flu, particularly the Spanish flu, which occurred in 1920, we see that the reason why that flu became a pandemic, in other words, crossing across geographic areas, was because of travel. Technology was still a factor. All right, so people traveled in trains, and that created the ability of that flu bug to travel as well. And so when we think about how health is shaped, we have to go back and think about how we live and where we live and how it transfers into our environment. When we think of major shifts in disease, we can now think about traditional agents of epidemics giving way to chronic diseases, diseases of fixed habitats. So we had a nice segue into this: obesity, fatty liver disease, cardiovascular disease, diabetes. And what we see now is that instead of having an epidemic, we have something called endemic. So we have low mortality and high morbidity, low death rate, high disease rate. So a really good example of this in North America is blood pressure. Hypertension is endemic in North America. Not a lot of people are dying from it, but a lot of people have hypertension. Similarly, we could say that obesity has moved into that category. There are a lot more obese individuals today, not a lot of people dying necessarily from obesity as a primary cause, so it's endemic. Travel is still part of this because people can travel around the world, and we still are faced with some of those classical diseases. And we could even say that certain strains of the H1N1 are endemic. In other words, they're occurring in populations, not necessarily with high death rate, but they're there, and when we have close quarters, things can occur and change at a very rapid rate. So what I want to do is take you a little bit step further, push the bounds of being outside the box a tiny bit, and talk a little bit about natural experiments. And natural experiments is where we take advantage of a population or a special circumstance naturally that isolates a particular problem. So let's talk about fixed habitats. This is a nomadic tribe. All right, they have group mobility, so they move as a group through the savanna. Their physical proximity during work and play is within the group that they move. So they work and play together. All right? They have natural resistance to the diseases that are within the mobility pattern that they're in. And because they have a group of individuals that's fixed, their natural immunity is within that group. Their health problems then are culturally specific, and they learn to deal with those health problems. And this is in East Africa. So what I want to do is just show you a very busy perspective of this, but what we see here is this is a very traditional population, and we can see that there are a number of external factors that are influencing this population. We can see the ecosystem, the environment. There's climate, all right? There's risks, there's stressors, there's diseases. We can see some reciprocal influences, their social cultural system, all right? Their subsistence, their traditions. And then we can see on top of that some other reciprocal influences, the bio-behavioral adaptability, so population dynamics, genetics, growth, physical activity, and then system stressors, external populations, whether they're neighboring, regional, or global. So that's your typical traditional population. If we go one step further, we can look at another population. And this is one that has encephalitis mellitus. And this is a traditional, and we refer to as a cosmopolitan population because there's actual movement. And they have a gene pool that either increases or decreases depending who comes into their group that they have or moves away from their group. So they have emerging and re-emerging pathogens. This is a group of people in Siberia. Now, when we look at their diagram, we refer to them as a modernizing but still indigenous population. And we see they have environmental changes. Siberia, you can imagine the weather. They have social, cultural, and behavior changes. They have a population, a donor population. In other words, they have migration. Remember, people coming in and out. And they have recipient populations that also come in and out. And then their health and their disease. So what we see here is that the major components of this model include social, cultural, and behavioral changes, environmental modification in a temporal context, migration, population movement, redistribution of genes, and an exposure to novel events and conditions. So there's an environment, right, happening today where there's adaptation going on, where they have to change and adapt to what's going on in their community and their environment. So now let's take one that we're probably most familiar with. And this is a working group of women outside the home. They work outside the home in New York City. And we're going to look at their normal response to their day. And we're going to look at typical conditions that affect blood pressure. So if we look at this group here, we see they're a modern population. All right, they're a subgroup within our modern population. There's a social environment that may actually create some stress. So they've got ethnicity, social class, norms, population density. They have the physical and the biotic environment, climate, noise, nutrition, pollution, more stress. They have behavioral, so their perceptions, their coping strategies, their habituation, because they may be immigrants coming into the city of New York, biological, psychosocial, neurochemical, their immune response. And then their outcome, again, is they have to adapt, they want to survive, there may be morbidity, and there may be mortality within that. You see up in here, their microenvironment is that they have work, domestic, leisure, and other. So in this group here, we have a combination of pervasive and dynamic stressors that alter their biological and their behavioral response. So what we see here is the red is their home stressed, and this is just their blood pressure response, systolic, and their work stress. So let's look at 9 a.m. They get up, they have a nice systolic around 109. As the day goes on, it peaks around 6 p.m. And then it slowly starts to decline and then goes down to, around 105 by the next morning. But look at their work stress. Starts off higher, peaks just after 6 p.m. So maybe 7 p.m., right at dinner time. Who wants to be that mom at 7 p.m. with 3 boys when you're stressed to the max and someone tells you that they jumped the school fence and broke their leg in 6 places? You want to be that family? Because that was my family not long ago, okay? Do you imagine if I had that kind of blood pressure, it would have shot right up. But these are realistic, and then it goes down. But you notice that the baseline never quite recovers. And then after a while, this baseline here becomes up here. And so you can see that over time, these women have a huge change in their blood pressure. And so what we see is they adapt in a very short time, and that adaptation may lead to early mortality. So our natural environment, our built environment, where we work, live, and play, is a multiplicities of actions that impact us. Frank Booth came one time to the University of Calgary, and he talked about how humans have inherited genes that have evolved to support a physical activity lifestyle. And I showed you that at the beginning with the fellow running, all right? And I have a kind of a comment that I use in one of my classes. I actually teach one class, and in this class, they actually do a blood workup on themselves. They do cholesterol, they do a nutritional analysis, they do a genetic tree, and they do a risk appraisal. And that's the class I teach, is basically looking at how they can prevent some of the factors in their life. But I tell them the first answer is always genetics. You need to know where you came from. You need to know what genes your parents are giving you. Because if your 2 parents both have high cholesterol, autosomal dominant, then there's a good chance that you might have high cholesterol. But the difference is, if you know that, you can choose to express it or suppress it depending on what you do in your environment. So you can have the best nutrition, you can go out there and exercise every day and suppress some of that genetic that background that you have. So genetics is a very important component of how we choose to live. So adaptation occurs, all right? That happens in terms of what we refer to as natural selection. So in biology, we look at adaptation from the perspective that we change in different environments. So adaptation, selection to different environments. Those novel traits allow survival and reproduce more effectively in an environment. And that produces, quite often, an entirely different animal. So people who are going to adapt and have low blood pressure, i.e., could live very well in New York City. But people who have high blood pressure might not live so well in that urban environment. So the evolution of adaptation, then, we can give a quick example here. And the first example, and maybe this is one example that we all relate to, is that adaptation occurs in our sense organs from a physiology perspective. So sensitivity is altered in response to changes in our environment. So for example, pupil size increases and it admits more light so that we can see at night and drive. Now, some people tell you that as they get older, now, of course, Dan Suratak, who's 100, maybe could tell us this, but as you get older, your night vision starts to decrease. Has anyone ever experienced that? And maybe what's happening is as we age, we lose that adaptation. So we do evolve. Despite what we may think, we're changing as our environment changes around us. So now that I've given you a little bit of a different perspective on the background, what I want to do now is stop a second and say, maybe the built environment is not where we should be. Or maybe we have adapted to the built environment. And if we have, do we survive and reproduce effectively in that environment? Have we adapted to sedentism? And if so, how do we measure if we've adapted to sedentism? And can we reverse sedentism? Is that what we need to do? Because if sedentism is responsible for chronic disease, i.e., obesity, fatty liver disease, hypertension, those kind of things, then we need to reverse it. But I don't think it's quite as simple as that. Because remember the New York women, they may not have been overweight, but they still had a response to the environment that they were in. So we see that some people have adapted, all right? Whether that's a good or a bad thing. All right, so we've got the fat TV, the thin man. Now we have the thin TV, the fat man. All right, so what has the evolution of sedentism done for us? So let's just quickly look at this from the perspective that if we think about being sedentary. So sitting at your desk, this is 1.8 METs. METs are referred to as metabolic equivalents. So they're talking about the amount of energy that you expend. All right? So sitting at your desk, working, you're expending about 1.8 METs. If you're just sitting talking, it's about 1.5 METs. And if you're just sitting quietly watching TV, it's 1. If we move up, we see that standing, from sitting to standing, is a 100% increase. I want you to remember that. 100% increase. That's huge. Even though it's only 1 to 2, it's still a 100% increase. If we move up to slow walking, that's 2.5, 250%. Keep going, 3.8, brisk walking. And what we see is that most of the guidelines related to physical activity tell us that if we want to have a risk reduction, we need to be doing 3.8 METs or above 30 to 60 minutes most days of the week. Now, really what they should be saying is we should be doing 60 to 90 minutes every day, all right? Because really, 30 minutes a day of physical activity is really a prescription for weight gain over a lifetime. And I can attest to that. I'm a very good case natural experiment on that, all right? All right? So we need to work harder. But my point is this. Think about sedentarism and think about from standing to sitting, that's a 100% increase in your metabolic equivalent. So if we look at it from a slightly different perspective, so this is basically looking at the muscular activity in your legs. Sitting induces muscular inactivity. Standing induces muscular activity. So my suggestion for all of you right now to have a 100% increase is to stand up. I know it's hard for you to do that. All right. So now we've had a 100% increase in our metabolic equivalents. That's a big change. Now sit down. And what I want to show you here is simply this. Look at the baseline of muscular inactivity here. As soon as you stand out of that chair, look at those peaks, the changes. And then as you're standing, there's an adaptability period there, right? It's not the same as this. And so recently I was at a conference called the International Congress on Physical Activity and Public Health, and they talked about these changes. And this slide actually comes out of Neville Owen, who was speaking there. And when we think about this, they've now developed what's called the fidget hypothesis. Now, I don't know about you, but I have a boy that fidgets. And I cannot sit next to him because I'm stressed, all right? Because he's moving and he's doing this, and we're sitting in church, and I'm thinking, well, Patrick, would just stop. Can you listen? He's doing this, he's doing his hands, then he goes like this, and he looks at his watch 18 times, moves his leg. He has burned so many more calories than I have listening patiently. All right? And that's the point they're making, is that the fidget hypothesis, for those of us who've adapted to sedentism, might be one way to help us survive. Or, over time, maybe this is what will happen. Sorry, I'm right in your way there. All right, what has technology done for us? Let's look at our typical day. You get up in the morning, 7 a.m., you have breakfast, right? You're sitting, you get in your car, you're sitting, you work in your computer, you have lunch, work in your computer, you're sitting, drive home, you're sitting, you have dinner, although it's a good thing to have a family meal, and you watch TV, and then maybe, if you listen to the guidelines from Health Canada, you might get out and walk 30 minutes, and then you go to bed. Looks to me like we've adapted pretty well to sedentism, right? So what has architecture done for us? Well, when you think about buildings, we've already heard that the staircases are in the back and the escalators are up front. So what has the architecture done for us? Has it helped us maintain our activity level, or has it actually made us more sedentary? I can't wait for CDC, the Center for Disease Control, to put this into the next risk factor. We've finally had physical activity come into the risk factors along with smoking, etc. And then soon we'll have buildings kill, all right? So we have global cities. We need to have a discussion of architectural design, and it should include the economics, which we heard earlier. It should include equality, emotional health, and environmental changes. It has to have that kind of context with it, all right? We have to live in our built environment. And if we look at replacing our natural environment, which we've done very well, then our built environment has got to be the most important element in terms of our setting of our daily activities. Now, this picture up here is from 1920, and it's a utopia picture. And they called it the ideal city. And what we see is people are segregated from cars, and we see that everything is very rigid, and function is very carefully looked at. So people, buildings, automobiles. Very little integration. And that's not really ideal for what we need. We need very useful designs. Now this design here, I'm not certain it's any more useful either, because look we're all in a little closed environment here, and there's no interconnection or play. All right? And so what we need to be thinking about is getting our architectures on the same page as us in terms of designing buildings that help us maintain our physical activity level. So challenging the professional architect, I think, is going to be quite a task, because architects are thinking about buildings in very novel design ways. But I'm certain that we can do this. Architecture needs to be a vehicle for social change. And the community needs to be actively participating in that design process. Now, when I was at this conference in Toronto 2 weeks ago, they actually had an art exhibit about I'm an architect. And what it said here is that you could go to this wall and you could write anything that you thought about the built environment. giving suggestions. And I spent quite a bit of time at this wall reading all these suggestions. And as I've said earlier in my talks, I really wanted to pull a few of the pink stickies off because they were so good, but I thought someone might take offense to that. But there were some amazing design examples here of what we could do to make our built environment better. All right, so now let's move forward. I've kind of given you a backdrop of where I think we should think about, but now I think that we need to go through and talk about the built environment. So I came up with the fact that, excuse me, I should talk about intuition first, and then I should look at theory, and then put that together with preliminary evidence and suggest that there is an association between the built environment, physical activity, and health. I thought I was very clever until I came up with the fact that someone had already done this and produced a very big book on this. However, I'm still going to stick to my intuition and start off with that. All right, so let's do a definition of travel behavior now. Travel behavior is the study of what people do over space and how people use transport. So the history of travel behavior from a human perspective is quite long. And what we see, excuse me, is the following. That, 4 million years ago we stood up because we had to multitask. We see later on that this emperor had new outfits for his armory, so what he decided to do was parade them for 21 miles so that everyone could see. That's a really important point, because when people see other people doing things, they're going to want to do it themselves. Then there was bets. Some guy walked 300 miles, all right? So we know that there's some challenges with behavior here. Race walking was invented. Who could walk the fastest? Then we see the first 24-hour adrenaline event occurred in 1762, where a guy walked 100 miles, 23 hours, and 15 minutes. Then we see the typical graduate student travel thing, where you graduate from either high school or university and you go on your year-long trip to Europe. These guys did that way back then. The only difference is they didn't take a plane and a train. They walked. So they walked from Germany to Sicily and back. They saw a lot, I bet. Then we have the first thoughts of a pedometer. A guy walked 100 miles in 1,000 hours on a measured mile. And then the walking club was formed in 1864, and then we came about in 1860 to 1903 to what we refer to as the pedestrian age, or walkability. So if we look at the history of what humans have done, walking has been a big part of how we've seen the world, how we've interacted in the world. So let me talk about intuition for a second. I walked to school when I was 6 years old, 5 years old. And I knew that I had expended a certain amount of calories because by recess, my stomach was growling. And in actual fact, when you look at this, 1 mile, 1.6 kilometers, expends about 1,000 calories. I walked 2.5 miles. I did that twice a day. So I expended 500 calories every day walking to school. 500 calories times 5 days a week, 2,500 times 4 months. You can see how those kind of calories add up a lot. What's interesting, though, about my travel behavior as a child is that when I was 7, my parents thought I was either old enough to have a bike, be responsible enough, or the fact that we moved and I had to ride further. I'm not certain which. But they gave you this blue rally bike. And, when you think about a bike, you work hard, you're late, and you get to school, and all you can think about is that motion of your legs going round and round when you're in school. What was cool about my bike, though, is that I could go so many more places. I could go everywhere now. I could go so far. And what was great about that is that when I came home in the evening and I was the youngest, I had something to say to everybody. I could say, look, I cycled up Mount Tommy today. Have you ever done that? To my older brother or my older sister. And they go, what? You can't do that. You're only 7. I go, no, I did that today. I have a bike. Then I would tell them about all the places that I didn't do. So finally someone was paying attention to me in my house. Because prior to that, nobody listened to anything I had to say. But I had something different to say. And so that made a big difference in my life. And in fact, I actually became quite a good cyclist after that. So my point is this. Travel behavior was set in motion for me as a child. Those habits of cycling and walking were integrated into me as a young child. And that's important because habits are hard to change. And you learn them, And when you learn habits, you form them by practice. And if you do that, then that stays with you. Many people want to change their habits, but they find it's very difficult. And that's an important concept when we're talking about the built environment. Because if there's an escalator in front of you and there's a stairs on the left of you, which do you take? Habits are hard to break. My mom also used to tell me stories about when she was young and how she biked to the tennis court, and then how when we would walk downtown, I was the youngest, so she never let go of my hand, and I was the one being dragged along like this. But everybody I knew walked, everybody I knew cycled, all right? We cycled to the local bakery, we cycled to the local corner store. So everyone's behavior in my neighborhood was the same. And that created a self-expectation, and that influenced how we responded to where we were going and how we got to where we were going. And that reinforcement meant that we cycled everywhere. I cycled all my way through, even my undergraduate university, I cycled all the way every day to school there and back. So what I'm saying to you is that stickiness factor, as Malcolm Gladwell calls it in his book, The Tipping Point, that social desirability is important. So if people see other people walking, they're more likely to walk. If they see other people cycling, they're more likely to cycle. And the mayor in Vancouver recently has changed the two bridges that come across the North Shore. And what he's done is he's taken one lane and he's made it for cyclists only. Now, he has a lot of auto-dependent people mad at him right now, all right, because there's huge lineups. But he has a lot of really happy, healthy cyclists that love him, all right? But he stood on his ground and he's made a point, all right? Hopefully, more people will learn to cycle. So travel behavior created a sense of belonging for me. It influenced where I wanted to live as an adult. I wanted to live in a community that was walkable. And so the walkable neighborhood, for me, meant that my intentions were already set. My belief was there. And if we're going to get people to walk, we have to create that new belief in them. And then we have to express and nurture their belief. So right off the bat, that tells you if you want people to walk, you have to support their walking environment. Or if you want them to cycle, you have to support their cycling environment. But there's complexity in urban travel. So I walked to school because it was only 2.5 miles. Or I cycled because I had 4.5 miles there, 4.5 miles back. Those are doable things to do, 50 years ago, not 100 years ago like that. But can my children walk to school? No. So that's kind of a drag, because they'll never have that same intention that I have to always want to walk. And if we build more urban and mixed communities, will that change walking to school? It's not straightforward, is it? So policymakers, communities, we all have to get back into the looking and lobbying for that neighborhood school. So what this brings us down to is really a model of behavior. It's about behavior. It's about behavior more than it's about anything else. So this is an integrated model of behavior, and it's predictive. So if our behavior is more physical activity, walking and cycling in our urban environment, then what are the environmental constraints? How do we work and change those environmental constraints? And just because we change those, will the intention of people change? Will the auto-dependent person change? And what skills do we need to make that behavior change? What kind of attitude? What's the perceived norm? And self-efficacy. Do they feel confident they can actually make that change? And then we can go back to beliefs and outcome valuations. We can think about our motivation to comply, and then we can think of efficacy beliefs. And then all of these other factors that we've sort of just very briefly alluded to, but your demographics, your attitude, your culture, your perceived environment, etc. All of those influence the outcome of where we're going. And so really, behavior is a key factor in making changes, and those changes that we make in the built environment have to also involve a behavioral change. So travel behavior is a little bit biased, and this isn't really that important actually, this slide is that because when we think about cycling and walking, they're both forms of physical activity. And one may serve as a substitute for the other. So some people can cycle and some people can walk, because actually there's a fair number of people in society today that don't know how to ride a bike. You'd be surprised, but there's lots of people that have never been on a bike. And so if you cycle, I cycled more as a child and a youth, and now I walk more. And we can look at this statistically, and what we see is that it's when we put a path model in, we see slightly different outcomes for walking and for cycling. Because walking needs a particular type of environment to be supported, and cycling needs a slightly different environment to be supported. But that's not really the issue. The issue is that we need consistency in whatever travel behavior we're going to choose in the built environment. But we've got to be aware of the fact that they're slightly different, cycling and walking. So what about these lived experiences? I explained to you what I did as a child. That was my lived experience. And that type of research is referred to as qualitative ethnography, where you get someone's story and you find a little bit about it, a little bit about that person. If we look at qualitative research related to the urban environment, we find that there's very little qualitative research that looks at transport and travel. And I bet every single person in this room today could tell me a story about what happened to them as a child in relation to their built environment. So, as an example, how many of you had a corner store that was in your neighborhood? Okay, well, a good few. How many did you walk or cycle to your corner store? How many of you thought that was a form of independence as a child? Oh yeah, see that rate's big, right? Independence is big. Well, if there's no corner store in your neighborhood now, how do you create independence? How do you foster that in your child today? It's pretty complicated. So what we need to do is look at, I think, some of the qualitative stories out there and learn what people think is important to them and bring those back in. It's very underrecorded and underrepresented right now today. So future research in the built environment should involve qualitative, that's a narrative style, so that we can understand what people think is important and what they would like. We need to understand how lived experiences is a way of learning about how people can change their behavior, and we need to use kind of a mixed methodology approach to enhance our research in the built environment. And there's huge gaps in the literature right now with respect to that. So both quantitative and both qualitative, and mixing those together. So this was an email that came to me on January 8, 2002. And it says the following: I hope you remember me. I'm the planning student from over in environmental design who was interested in urban-suburban form and its possible effects on health. So that came across my desk one day. Do you think I could remember who she was? No, of course not. Couldn't, all right? But I said I invited her to come to my office. And when she came to my office, she said, I want to do some work on physical activity and health related to walking. Now, for those of you that are in the exercise domain, sometimes, we get our hair on our neck up a little bit when someone else wants to come into our domain because we think that we know so much more than they know about exercise. So she came into my office and she said that, and I'm looking at her thinking, environmental design, what do you know about physical activity? Well, she said to me that one day she made a decision to change, and that change was impacted to the option of being able to walk to work. So she'd moved, and she realized that she could walk to work. Okay? And she said it was possible for her to change because of the proximity of her work environment. And she experienced what is called a change moment. And that change moment actually resulted in her losing about 25 pounds. And after she lost that 25 pounds, she had a feeling that she became more fashionable, that people were looking at her, that people were paying attention to her, that people even started to walk with her from her own neighborhood. So I was a little humbled by her telling me this story in my office. And then I said to her, you know what? There's actually a model for what you've just described. And this model talks about voluntary behavior change. And so what's the status quo in your life? And then deciding to change to achieve a personal goal without any pressure from anybody else. You make that decision on your own. And there's a couple of reasons why that might happen, but you might have a personal goal. And the result is that you continue to behave differently because life is better. When you've made that change, you realized how much better walking to work is. She walked to work, she lost weight, but then she realized she didn't need a car. Then she realized she didn't have to pay car insurance, and then she realized she didn't have to worry about gas. And she didn't have to realize about someone in Calgary merging into her, because we're notoriously bad mergers in Calgary, right? And everybody ends up in an accident. So a whole slew of things changed in her life. But the key to this is she made that decision without external pressure. It wasn't her family physician telling her to walk more to lose weight. It wasn't the fact that she couldn't afford her car insurance because the rates had been changed. She made that decision. And that decision is how we need to get people to think about the built environment. We have to get them to make that decision on their own. Because if we do, that behavior change that they make is sustainable, and they'll keep it. And that's the model that surrounds voluntary behavior change, and that's key to the built environment. So voluntary behavior changes in travel achieve a personal goal in terms of improvement of lifestyle or behavior that is congruent with your value system, and therefore they're sustainable. So value system becomes very, very important. What you value in life. We have to be careful, though, because there are a few people in the world that self-select themselves into things because they're already there already. So, for example, if you're an exercise person, you probably would be getting up at some point early in the morning to do exercise before your workday. You're probably the person that likely will walk to work as well. So we have to be careful that we don't over-magnify our response, because there are many people who won't do any of those things. All right, so what about looking at some studies then in the neighborhood? So this student wanted to look at unhealthy suburbs and the role of walkable neighborhoods. And so when we look at the research, we see that it says our communities should be designed to incorporate safe walking routes, bike paths, bike lanes as real choices for transportation. Absolutely. We all agree with that. All right? However, choosing to be active is clearly easier when neighborhoods have workplaces, when neighborhoods have schools, or commercial centers, or recreation centers, and they're geared towards active living. But who puts all those things in the neighborhood? It's not the exercise person. It's not the physician. Who is it? Exactly. So they're the people that we need to have a conversation with at the table. So we need to bridge municipal planning and health together. So let's look at travel forecasting. When we think about this is a big part of the provincial government's mandates. And I don't know if it's happening in Edmonton, but right now in Calgary, they're doing their travel forecasting for the next 20 years in terms of building roads. All right? So you look at the number of cars, you look at the destination they're going to, who accompanies who, when, the sequence, the route, etc. And what makes me laugh about this is that I know a little bit about this. And what this is it's a descriptive travel diary, and it's part of a transportation survey or inventory. And municipals, provincial, federal, they have tons of data in this area because they employ university students sometimes to do this. And I'd forgotten about this. This is another life. I actually was one of those students. I dug these pictures up. That is me. That is me. This is a long time ago, I can assure you. And I am writing down these people's travel diaries of what they've done. We pulled people off the road. We asked them all those questions. Then the provincial government took it, and they made all these roads where I worked. I traveled all over BC, the British Columbia, doing this for a summer. I was an engineering aide 1, 2, 3, eventually got to be a supervisor in my 4th year of university. And that's what we did. I'm a little embarrassed about that, but that's what I did, and that put me through university. And the Coca-Cola was one of the end results of my travel diary work, all right? That's how long ago this is, all right? So, pedestrian travel. This is the first study that I was involved in that we did. And what we wanted to do is we wanted to look at the urban form in Calgary, and we wanted to see how it accommodated pedestrian movement and contemporary suburban form, and how it did not accommodate what we thought was pedestrian movement. So the question was, do particular settings inhibit or encourage travel, and what elements contribute to this? So if we go through the literature, we can find a lot of contextual background in this area. So permeability, the ease of foot travel. So for example, when I was at this conference in Toronto, we walked a lot. Toronto's a very walkable city. However, there are some constraints for some people who are walking in Toronto, and that is that they've got the old sidewalks, the brick interlaced sidewalks, and then cement ones next to them, and it's very uneven. So if you have a slight gait problem, or it's crowded and you're not watching, you could easily trip and fall in that environment. So ease of foot travel means everyone can be accommodated. The next one is connectivity. Does it link up somewhere? Excuse me. So some of the new suburbs in Calgary, our urban planners and designers have put in these suburbs, and they put these great paths, but then they stop. There's no place to go. They just stop. They stop dead. And I'm thinking, why would you do that? Like, what's the point of that? So we need connectivity. Legibility, finding your way around. So if you've ever been to one of these, I don't know, the urban planners are playing with our future Alzheimer's, and they name everything the same. So it's Cotton Glen, Cotton Road, Cotton Crescent. Like, you know, that's not very helpful. Comfort, safety, all right? Are you going to walk where there's no lights at night? No, you're not, all right? You have to be comfortable in your walking environment. And then density, variety, interest, mix of buildings. Remember that we're very visual people when we're out walking. And so, for example, this picture here is of a street in Dublin, Ireland. And when you walk down the street, every door is painted differently. And that really piques your visual acuity because you keep looking, thinking, okay, no, I've seen 4 purple doors, I've seen 8 pink doors, you know. You're thinking about what's going on. And by the time you finish all of that, you're at your destination or where you're going. So amenities also are important. Can you nip in and get a bottle of, well, no, we don't buy a bottle of water anymore. Can you nip in and get, you've got your travel mug with you and whatever, all right? Can you do all those things? Because that's important in terms of supporting a walking environment. And this is just showing you where the infrastructure is not keeping up with the demand of what's going on. So the environmental contexts are difficult to pin down because they invoke behavior decisions at a variety of levels. So think about someone who's about to walk. What is it that they need to walk? Now, if you were in, I'm understanding that the weather in Edmonton was the same, but last Thursday in Calgary, if that was your day to walk, you wouldn't have been walking because we had a blizzard, all right? And so when you think about the constraints of what goes on, all right, what is it that make and help people walk? So human behavior is very, very complicated, and I recently picked up this book, Multiplicities, because it was looking at the new science of personality. And I think that we have to understand people's personalities a little bit to help them become more comfortable in moving towards more physical activity in relation to the built environment. So what supports an environment? And because if we support their environment, will they exercise? So what are the requirements? Well, in a recreational setting, you need something that's good for recreation. In a utilitarian setting, you need somewhere to go and how to get there, and we're going to talk about that in just a second. Safety, again, is key. In the winter, you need to be able to provide cover. All right, so I think I heard, I'm positive I heard the word heated bus stops or something earlier this morning. I hope everyone in Edmonton writes that down. I don't think there's one heated bus stop in Calgary, all right? So you guys could be the first, and then we could jump on the bandwagon after you. All seasons. So people have to be able to walk all seasons. And the presence of street life is critical because people will come onto the street if there's other people on the street. So some of the new dog walking research demonstrates that people who have dogs walking actually cause other people to come out and walk. Go to the city of Barcelona in Spain. It's an extremely walkable city. In fact, Lloyd Benz and I can talk about being in Japan, in Hokkaido. Incredibly walkable, wasn't it, Lloyd? I mean, we walked till 2:30 at night because the climate was fantastic, and there was so many people on the street there. It was fantastic. You wouldn't do that in the city of Calgary. Okay? I don't believe anyone would be walking at 2:30 at night in the city of Calgary unless there's some other reason for them to be out there. They lost their car keys or something. So visual is also important. So understanding pedestrian travel then. Raj, he sort of referred to this a little bit. 40% of all your day-to-day needs need to be in your neighborhood. How many of you can say that that's true of where you live today? Not many, right? So you've got to go somewhere to get what you need. 70% of individuals will walk not 500 meters, well, that's way too far, 500 feet for their daily errands. 40% will walk a fifth of a mile, and 10% will walk a half a mile. That's not very far, all right? But that's all they're going to do. So if you want them to walk, bring it to them, because they're not going to go any further. They're going to jump in their car. We did an urban form analysis in Calgary because we wanted to find out which of the environments that were already there were supportive of walking. And so we looked at some of the previous research, and there was a precedent study done by Southworth and Owens in 1993. And then we took that research and we looked at 3 common neighborhood types and how they were analyzed in relation to this research. And what we found was the following, that the grid type, all right, is the best type of urban form to create walkability. So if you think of this grid type here, if this is your house here, there's many ways to get to your house because it's a grid type. So if you are the 3 pigs and this is your house here, you, all 3, could have split up and the wolf would never have found your house because you would have confused him, right? If we look at this one, this is Loops and Lollipops. It occurred about 1959. Kind of lacks features in terms of walkability, all right? You know, you can see legibility is pretty tough here. You can see now that the street size has changed, all right? And that from here, we have streets parked on the road. Here we have driveways. And then we have what's referred to as a warped parallel type, 1982. Relatively successful in terms of pedestrian environment. And it's kind of got the best of a little bit of this and a little bit of that. And there definitely is more ways to get to your house there, but it, again, is slightly confusing. Not as good as this grid pattern is. Are our suburbs designed on this pattern? No, they're not. So intuitively speaking, they're going to be less walkable right from the get-go. So recommendations for current policy then could be the following. We need a fundamental change in how communities are conceived and planned. I'm sure everyone agrees with that. We need to plan for all people. And this may be slightly different than the way that our cities are planned right now. All people walk, but not all people drive. And right now we build all of our neighborhoods for auto dependency. So driving is an exclusionary activity. It's a choice you make, yet we know everyone can walk. So if planners plan for pedestrians, then they plan for everyone. And the reverse, of course, results in exclusionary planning. So if you live in a suburb in Calgary and there's no LRT, of which there's only 4 ways the LRT works, you either have to take the bus or you have to drive. And I believe Calgary is known for having the worst transit system of an urban center in all of Canada. It's very difficult to use the transit system in Calgary and get to somewhere where you want to get to in a good period of time. So unfortunately, that's the way that the city has kind of been designed right now. We then had some opportunity to carry on and do a slightly different study, and this one was called the Nudge Project, Neighborhood Urban Design Gets Exercise. And as I've been saying, we were I was feeling really proud of myself, you know, that I came up with the word nudge, used that acronym. Then I found out that someone's written a book called The Nudge about health, wellness, and decision making. So I'm not as smart as I think. Anyways, we looked at the neighborhood level, and we looked at differences in physical activity, and we also looked at the livability of it. And this is just a picture of myself, Bev Sanderlak, who was on this with me. It was actually funded by the Alberta Centre for Living, and this was a -30 day that we had to do a press release. So what we found is, will people self-select themselves to a walkable neighborhood if those are the learned habits and the value system that they have? So do residents prefer to walk or choose to live in more walkable neighborhoods? And is there a built environment impact on pedestrian travel? So we actually went door-to-door survey, and we looked at residents that were in a high walkable neighborhood. That was our case group. And then we reported the higher density mix. We looked at the land use. We looked at the street connectivity. We looked at the aesthetics. We didn't actually look at safety per se. We used the news questionnaire, which is by James Salas. And then we looked at a control neighborhood, and that neighborhood was considered to be less walkable based on those things of high density, etc. And we looked at proximity to where people were going. And what we found is that there was certainly more walking in the walkable neighborhood, but they were very short trips. They were frequent but short. So if you had to go down to the drugstore, which was less than 500 feet away, you ran down, picked up your Advil, and ran back up. If you had to go to the dry cleaner, you ran down, got your dry cleaning, and went back up. So they didn't walk very far, but they did lots of little tiny trips. And we also had a puzzling outcome of this study, and that was when we looked at walking versus strolling. What we found is that the group in the highly walkable neighborhood reported walking, but the group in the the control neighborhood reported strolling. And I, at that point, didn't understand the difference between walking and strolling. So what we did was we went back and we tested a subsample of our groups who completed the survey by mail-in and door-to-door. So what had happened was we'd gone door-to-door, but if they weren't there, we left the survey for them. And then some of the people that are the students that I employed went back, and they'd forgotten they'd left a mail-in, and they re-interviewed those people. And so we had 2 interviews for those people, and we went back, we looked at it, and what we found was the following. There was a low correlation for walking, but a higher one for strolling. In other words, people didn't remember very well if they walked or not to the drugstore or to the dry cleaner. But people could recall how many times they strolled per week, how many times they were out in their environment, because there is a reason for that strolling. And strolling is interesting. Walking implies a destination. Do you remember me talking about my mom dragging me and walking very quickly? Because she had a destination in mind, right? She was going there, going back, and we're catching the bus home. No fun, let me tell you, involved in that. But if you're strolling, it implies you're with someone that you want to be with. You're probably talking to that person, you're discussing your day, maybe you're planning your holidays, maybe you're out because it's beautiful, you just want company. It has an emotional attachment to it. And that emotional attachment actually creates better recall for people. Can you remember when you're on a holiday and you're walking and you see one of the 7 wonders of the world? It's probably incredibly visual in your mind. But can you remember when you were walking yesterday to work? Do you remember anything about what you were walking to yesterday to work? Did you get to work on time? That's probably the most important thing. So when we think about walking and strolling, maybe there is some advantage to having neighborhoods that have meandering pathways and walkways and things like that. Maybe that's also an important concept, not just the fact that destination is our outcome. Having said that, we thought we were pretty clever, but of course somebody else published this. And what they found is that when you account for self-selection, neighborhood characteristics, perceptions, impact strolling frequency. Characteristics of local commercial are important for facilitating shopping trip. So she's walking to work, they're strolling. Somehow or other, we need to incorporate both of those into our environment so we get people out strolling and people walking as travel to work. We got quite a bit of media flack for the outcome of this study because does your neighborhood make you fat? And you can see why a reporter would want to be the first to publish that. So it was quite interesting. And then we had another one where slim in suburbia, fat chance. So this created a lot of publicity for us just on a very simple little study. All right, the next one we did was to look at whether kids, green places and spaces actually help the playability of a neighborhood. So did your neighborhood design change over time with respect to open green spaces and parks? Did your neighborhood design impact your children's ability to access those spaces? So I had a little grad student, Megan Nolan. Actually, she was an undergrad when she was working for me doing this study. And we went out into the neighborhoods and we decided to look at what impacted playability. So we looked at 4 neighborhoods And we mapped, analyzed, and compared their designs. We looked at the open space types in those neighborhoods, how they were developed, and how they applied to each neighborhood. Then we looked at the catchment area of the neighborhood and what it was used for in terms of accessibility. And then we looked at we couldn't look at quantitative work, so we actually went out and visually observed people in their neighborhoods. And this is what we found. In 1914, Hillhurst was built. And if you look at Hillhurst, you can see that there's a buffer space between the sidewalk and the road. That there's roads, or that the cars are parked parallel along here. So they create a buffer as well for kids to play on the sidewalks. There's some parks across the street from the house, so you could actually watch your kid play here. And all of the houses here face the front of the road, so you can even watch your kids from inside the house if you're making dinner. The next one was Glamorgan, 1958. Radical difference you can see here. Huge change in the streets. There's driveways. We have huge park spaces, so that's with the school. You can't watch that from your front house. And you'll notice that the house is now set further back from the road. Next one was Temple, and this was a big, huge area in the northeast of Calgary. They narrowed the streets a bit. We have duplexes. Again, huge, huge open spaces. This catchment area is also a drainage area for water. And we've lost a little buffer system along here between the sidewalk and the road. And then the last one was Somerset. That was our control one from the previous study. And you can see that Somerset is a completely different type of neighborhood. We have no sidewalks on some of the streets. We have one sidewalk on some of the streets with a buffer. And you can see that now garages take up the presence of the front of the house. So in actual fact, you can drive in your garage and never say hello to your neighborhood and maybe not even know your neighborhood. And I have a really bizarre theory, but I think this is why grow-ups have occurred. Because we have front garages and we don't say hello to our neighborhoods anymore. Get rid of those front garages and maybe there'd be less marijuana grow-ups in houses. I don't know. That was just to wake some of you up because I see I'm losing you a bit. And then we had all these tot lots. You can see 1, 2, 3 tot lots all together. It's great for a mom with 2-year-olds. You go to here one day, and Tuesday we'll go here, Thursday we'll go here, you know. But no place for when the tots grow up. Where do they play? Can't play in a tot lot. So there's a big difference in these neighborhoods. If we look at open space, 1914 to 1995, Hillhurst, lots of open space in terms of, because it's a grid system mostly. We see lots of green space here. 1958, we lost a lot of the green space and it became big green space. And if you lived over here, that's a long ways for your child to go to here. Temple was this big area in northeast Calgary, and you can see that there was a bit of a change, more green spaces, but very, very dense housing mix. In 1995, we had a little bit of connection going on in these green spaces, but still not great in terms of the average little neighborhood. So what did we find? We found if you want your kids to play in your neighborhood, to perceive its playability, you need to have an older neighborhood. There has to be sidewalks that act as a buffer from the street. The roads need to be narrower so that traffic is forced to travel more slowly. And so there's parallel parking because that creates a buffer. You need windows facing the front of your house, not the garage, so you can easily monitor your kids. And your green space design needs to be simple so it can accommodate a larger demographic. Because kids will find to play, dirt is good, right? They can play in dirt, right? But an older adult can't play on a tot lot. But they could sit on a bench that's next to the dirt that the 2-year-old is in. So we need to think about designing our spaces that's inclusive for everyone. If you ever go to Barcelona, you'll see that that's very true. So, free-range kids, that's what we want. We want our kids to range freely in our neighborhood. And of course, someone else published our results. I love it when people publish my results. I just wish they would put my name on it. So what did they find? They found that parallel parking spaces create a perception of an active, friendly neighborhood. They found that green spaces, terraced housing, safe walking, water is important for kids apparently, really important for kids. They like water, all right? And a 30-kilometer zone. So if you think of Billy from Family Circus in the paper, you can see this is what you want your kid to be doing, all right? So our last project then is Eco-Euphoria, and this is our CIHR grant, Canadian Institute of Health Research grant, employs a a few of us along the way. This is Dr. Alan Shields, a medical economist, Bev Sanderlach, an urban designer, architecture person, myself, Pierre, our little economics fellow, Christine Friedenreich, who is mostly involved in cancer research but is very well known for physical activity. Gavin McCormick, my great postdoc. I love him because he does everything. And then Francisco, who works with Bev, and they work together on pulling this together. So what does this look like? That's what a $600,000 grant looks like when you put it on paper. All right? We have a literature review, we have precedents, and then we have our best practices. We have self-reported physical activity, we have a walk shed, we have quality of the physical environment, and then we work through all of these things to get down to our health outcomes. What's the relationship between walk sheds and our neighborhood quality, and then what's the economic foundation for looking at health. We're almost through this grant. And basically, if I could give you a one-liner on it, it's simply this. If you put sidewalks on both sides of the street, will that make a difference in terms of cardiovascular health? So, what we know is that sidewalks contribute to the positive image of a neighborhood, but presently there is no research to identify a dollar value associated with increased walking and reduced chronic diseases. So what we have to do in order to have that happen, we hire an economist. He puts a dollar value on all the things that we know that are important for walkable neighborhoods. And then Stats Canada eventually will have enough data from them, from their database, to map that to cardiovascular health. So in about 6 months, we should be done. I know you can't see this, but I'm going to walk you through this, all right? Does walkability, if we want to retrofit, how much does it cost? So I'm going to take one neighborhood here. This is Glamorgan, because we're familiar with that one. It's a warped grid block pattern. To do the walkability improvement cost is about $32 million. So we have some residential to commercial rezoning we need to do. So we have to take some houses out, right, to create some spaces. So you have to buy those from people. Our block size and our connectivity costs, so we have to make sure that everything has an end result. So it just can't end, it's got to go somewhere. So we have to connect a few things. Open space, we don't have to worry about that. And our total cost is about $63 million. So to retrofit neighborhoods, to make them more walkable, to increase the travel behavior from a pedestrian perspective, costs a lot of money a priori. It'd be better if we could start off and do it right to begin with. Now, let's just get down to the nitty-gritty. So let's say we want to put in street lights. Each street light costs $4,000. Well, if we need, 22 or 300 of them, you start to multiply that up, that's a lot of money. What if we want to put in more trees? In the city of Calgary, each tree costs $2,000. Well, if we have to put in a whole slew of trees, we're going to be at $23 million in no time at all. What about a crosswalk? That costs money. Crosswalk signs, crosswalk lights. Tell me that a crosswalk light does not cost $123,000, but apparently it does. Curbs, to extend them, to remove them, about $16,000. So when we start to add all this up, it's huge and it's a lot of work, but it could really help the employment factor in Calgary because you're going to employ a lot of people to retrofit if you had this money. So let's summarize. Good urban design is critically important. I think we could all agree with that. Intuitively, we know that people have a hard time being active if opportunities don't exist. And we know that the evidence supports making changes. However, necessary but not sufficient. For some of you who've taken an epidemiology course, you might remember Mill's canon laws. There's 11 of them. This is one of them. Necessary but not sufficient. There's that technology thing again. Improved conditions may be necessary, but they are not sufficient for the adoption of a healthy lifestyle. Why? Because behavior is the key. We have to work with each individual person to help them make those changes. So a health inquiry into the complexity of the causal links of the built environment, we can't answer that today. We have to recall the interaction with how the physical environment and the built environment relates to basic preferences how we learn, have a learned behavior, and how our lifestyles are actually impacted by our socioeconomic status. And we haven't talked about socioeconomic status today, but that's a huge factor in terms of walkability within neighborhoods, because like-minded live with like-minded. And so if you go to a ghetto in Los Angeles and it's not cool to walk, you can do everything you want to that neighborhood, but nobody's going to walk there. So let's have a quick review. Sedentaryism is a response to a particular environment. We've moved along to this environment. Cubicles, we need creative, proactive solutions to what we do. If standing can make such a big difference, then we need to think about our work environment from a creative perspective. Now, I personally, you can see that I can't even operate this. I could not walk on a treadmill and work on a computer at the same time. I know my limitations, all right? Lived experience. If there is a story to tell, it means that change has happened. So we know we've moved from where manual work has become more technologically dependent. We've moved from playing outside our houses to playing inside our houses, but sitting as we're playing. So there's a story to be told out there. We've got to find a way to work with those stories. Populations and our natural environments and our fixed habitats. We've got to think about our fixed habitats and how we have adapted or haven't adapted or don't want to adapt to our fixed habitat. And that means that we need to know the anthropological, the epidemiological, and all of those evolutionary constructs. And it's not easy to solve because experimental research design is very limited because it costs a lot of money. So before we change a building, we're going to need to know that that building works. There's lots of opportunity for change, but we have to remember the path of the built environment in health. All right? It's looking like it's linear, but it's not really a linear path. We have all those determinants that influence our health. We have behavior that influences physical activity, of which there are quite a few, and then we have our health outcomes. We have to go back to our frame of reference. What is our actual frame of reference? We were meant to move. So how do we change determinants and behavior to impact our health? Well, we need to know people's beliefs, and we need to know what they value, because they will not change unless their value system changes. So let's take an example of 17 to 22-year-olds. Intention is a determinant of action. There's one lived experience or a qualitative study on young 17 to 20-year-olds that's in the literature. And what that says is the following. They are not going to give up their automobile. When they hit 16, that's what they want. They want an automobile. They are so geared towards having an automobile. They're not going to give that up. But what they really value is climate change. And so they're going to work really hard to ensure that the climate has longevity. Are they going to give up their automobile? No, they're going to solve that problem by developing some fuel source that has no pollutants. However, they value climate change. So maybe there's a way to get to this group through a slightly different way, a creative solution that involves them. That's how we have to think. Weight gain is a slow creep. 30 calories extra a day is 3 pounds a year. All right? Think about that. Just 30 extra calories a day. It'd be way better just to walk to school back and forth every day, right? Because that's 500 calories you're getting rid of right off the bat. So more time on your feet today and tomorrow will make the difference between being lean and getting fat. So when we stand up, what happens to our muscle inactivity? Peaks. It's like an epidemic, right? It shoots right up. It spikes. It's a 100% increase of our activity. Sitting induces muscular inactivity. Getting out of a chair produces muscular activity. 100% change in the MET value of what we do. So if you all stand up right now, you'll have 100% change in the MET value of what you're doing. You know, this appears harder than it looks. I'm not certain why this is. All right, you can sit down again. Thank you. So back to our model again. All right, our frame of reference. These are just a couple of quick things I pulled out of the paper. This one says, Timmy, please tell me you're not using Google Earth to play hide and seek. You know, the new iPad, someone's going to be out there doing that. This is the new Park 4, where they take the urban environment and they go as the crow flies to a destination. These young people are amazing. They're acrobats in the urban environment. They go over staircases, they climb up walls, do flips. It's amazing to watch. But maybe that's a solution for a particular age group that we need to work on. Maybe our phys ed classes should be working in that kind of a dimension, getting them out in their urban environment and using their urban environment as a playground zone. And then this last one was in the paper, and it was about the 33rd annual Mother's Day run and walk, and this was in the section, where you have a bit of a complaint, and so you write something, and it says here, Jake MacArthur says, unbelievable that people are allowed to traipse through neighborhoods for the Mother's Day run and walk. So this person replies, I'm afraid, Jake, what is unbelievable is how you view, sorry, I can't quite read this correspondence. You must be trapped for the whole day. Mostly, you felt trapped for a whole day for a mere few hours when people were running through your neighborhood for a purpose that was very important in that it looked after intensive care and special needs at the Peter Lougheed Hospital, the Rocky View, etc. So here's a guy who was incensed that all these people ran through his neighborhood for 3 hours to do a 10K walk run. Behavior, I'm telling you, is the key. That behavior is going to be pretty hard to change, all right? You put a tree next to that guy's house, he's probably going to have a complaint. You put a piece of grass next to his house, he's going to say, oh, I have to cut that. I don't want to do that. We have a lot to work with. So we need to move beyond prevention, and that's very hard for me to say as someone who is involved in the area of prevention, toward creative and proactive possibilities. So this is a tiny little clip here. So as you can see, we do need to maybe think outside our box, do something that has a creative potential solution for what we're doing. Here's a couple of other quick ones. So capturing a problem and reinventing it. So what if we took the energy that we use for walking and translated that into battery power? And then that battery power, fuels your phone, and so you don't have to pay for your cell phone. That would definitely attract young people. We have one that's going on when my grad students, Megan Nolan, and she's looking at capturing physical activity movement on your iPhone, and then we translate that into calories used. So at the end of the day, you look at your iPhone, and you can find out how many calories you used in your work environment. That will attract people, but it will also help us with our research to capture real-time physical activity in terms of energy expenditure. So what about social desirability? What about being that older person? They're not going to go to the gym and play. And this council in England, they actually put together this open-air gym. There's a few of these in China and Europe. But what's cool about this is this woman, look at, she's already got sensible walking shoes. She knows what exercise is all about. And she's 79 years old, and she pedaled at a high speed backwards on the cross trainer. Suggests that they may be too easy for some pensioners, although she says the machines can go as fast or as slow as you want. You only do what is suitable for your abilities, she said. Now, some people went to school to learn that concept. She obviously knows. She was a keen skier until a couple of years ago, but says she doesn't like normal gyms, adding, this encourages me to get outside and being in the open air. Remember, we've come from the savannah. So, if we quickly look at the last little bit here in terms of evidence related to sedentary behavior. Identifying relationships of sedentary behavior with health outcomes, there's a lot of information coming towards that. Measuring sedentary behavior, not so much, and then looking at identifying the determinants, and then using the relevant evidence to form public policy. So we have a long ways to go to really put all of this together. Socioeconomic model is the key, the individual, interpersonal, organization, community, and public policy. We all have to work together. So coming back to that very first one slide, that one answer slide, the multiplicity of factors and actions is critical here. So if we think about what has to happen, you may know about the halo effect. You do one behavior, and it translates into doing another behavior. You start to walk, then you're going to change your diet. We need to nudge people, push them forward a little bit. We need to get the evidence. We need to remember where we came from. have a community involvement, and clearly planners are important. So behavior is important, research is important, default models, making sure our environment's important, having physicians come on board, having planners come on board, having great postdocs, having all of us involved in a community environment is really the way to attack an interdisciplinary and a multidisciplinary perspective. So my very last slide is the first title that I came up with that I was encouraged to change, but I still like this: Urban Fatigue and the Paradox of Modernity. We've moved from the savannah to a modern environment, but what's good for the goose is not always good for the gander. What's good for you and me will work, but it may not work for everyone. So we clearly need to think outside the box. Thank you very much, and just a quick acknowledgement to the Alberta Centre for Active Living, for the Population Health Intervention Research Centre, where my colleagues are from, and for the Canadian Institute of Health Research for my grant. Thank you very much.